Yeah, I'd like to read the story that you posted on your X account. It's a true cancer story. It's Easter week 1952 in the city of Baltimore, and a little girl is dying of advanced, incurable cancer. Her renowned oncologist notifies her parents that there is no further treatment remaining, that her disease is 100% fatal. In fact, the priest had already dropped by to administer final rites. Faithful and feisty as ever, her mother refuses to comply. She instead bundles her daughter up, drives her to a local cemetery. There, she is laid on the tomb of Mother Elizabeth Seton, while a group of nuns pray for a healing. Back in the hospital several days later, there's no trace of disease. Her cancer has completely vanished, never to resurface again. Decades later, the Catholic Church interrogates all of her treating physicians. None are able to explain the mystical recovery. Her Jewish oncologist even testifies, the only reason this case has not been written up is because I have been too afraid to do so. Soon thereafter, the Pope declares the girl a miracle cure, and her case is used to canonize the first ever American-born saint. At 77 years of age, Anne O'Neill still loves to recite her story, share her faith, and prove the power of prayer. Do you believe, Dr. Singhvi, that the medical establishment actively suppresses evidence of spiritual healing because it threatens the pharmaceutical industrial complex?
Perhaps I don't know the answer to that question. I can only speak to you from the perspective of the physician. And I would say, I don't think it's that nefarious. I really just don't think many physicians, I mean, it's like, and I noticed this during COVID, it was like, you worship science or you worship God. Like it's very rare to have sort of what we have, which is an open-mindedness and open-heartedness to be able to be receptive to it all. And so I really just think that especially as you're going through the process, you become very logic driven, very much about what can be proven, what is objectively obvious, what can be reproduced and measured. And when that's not possible, and the intervention is a little bit more abstract or nebulous, like intercessory prayer or faith in general, I think doctors get a little bit discombobulated, quite honestly. And so, and it's interesting because I would say most serious scientists usually scoff at these sort of anecdotal cases, this case report, this intervention that can't be proven or measured. And they're always in favor of what the research shows. And I have always been on the other side of that. Like, I have been so fascinated by the case studies, the outliers, the miraculous, the inexplicable, because those for me show me what we are capable of as human beings. Like, show me what's possible.
I think you're uniquely positioned to answer this question. So you just mentioned show me the science or show me the data. Well, our gold standard science is comparison against a placebo. And so we do observe, placebos being able to influence healing. So I don't understand that, that debate on the side of the doctor says, so show me the data, because it's clear. It's why we're comparing against placebo, because we know that the body has its ability to heal on its own. So what is the belief system in Western allopathic medicine then around the power of the placebo effect?
Beautifully said. And there are so many interesting cases around the placebo. I mean, I've seen it with my patients where I literally had a patient who I was practicing in LA. So there's a lot of fancy people that rolled through. I mean, this woman was like Hollywood royalty. She'd just been to the White House to screen one of her movies. And she had been diagnosed with a cancer and was doing fine. Like, she had been in remission for some time. I had just spoken to her and she was doing fine. She was happy. She was healthy. She was back to normal life. She had a PET scan like a week later and it showed a lymph node that was positive. I mean, she went down. She was dead within a month. And it was just this like, oh my God, like, the human body and the mind, and then we talked about this, the mind body connection. I think, to answer your question, I think people in the medical profession, again, scoff at the placebo effect. They really think there's nothing there. It's neutral. It's mind-boggling. I agree with you. I don't understand it. To me, the placebo effect is the most remarkable thing. It shows us again what the human body and the mind, when optimized, is capable of. But sort of going back to spirituality and the actual, okay, you want objective data, I can give you that as well. And this is what I responded to your post on, is that over 1,200 studies have shown that a regular spiritual practice tacks on 7 to 13 years, depending on the study, to a patient's life expectancy. And that's 7 to 13 years with less disease. These people cope better. They heal faster. They have less anxiety and depression and mental health issues. They're more satisfied. They're living better, right? In terms of, for the physician, if you can broach these topics, you're decreasing burnout because and I'd love to talk about this, but this whole godlike complex that physicians develop, I think, is because there is a void of believing in something bigger. Suicidality in doctors, when suddenly you are the one who is responsible for another person's health and whether they're going to be alive or not. I mean, think about how much stress that sort of transfers onto this mere mortal. And so it leads to better doctor-patient relationships all across the board. Spirituality, religion, whatever you want to call it, is really critical. And I actually think that is an abdication of a physician's responsibility if this issue is not being broached at every single patient appointment. Because if you want to talk about magic bullets or the elixir of life, this is as close as we get to it, quite honestly. You think about, like, how much does dialysis add to end-stage renal disease patient's life? Or how much does a statin add? Or how much does Herceptin add to a HER2/neu patient? And I know I'm using some jargon there for your listeners, but it's like not much. And how much have we poured into, developing these and the R&D and the studies and the so on and so forth, when something very simple that has zero side effects, mind you, can really revolutionize your entire life. Well, and so I'll just end with this when it comes to spirituality. And I think President Trump is leaning towards this, but if I was Surgeon General, and I know it's a very ceremonial position, but there is some impact that you can have in terms of what you're bringing to light in terms of the public conversation and dialogue, is I think we need to bring spirituality back into day-to-day life as a public health campaign, quite honestly, because I've never seen anything that impacts collective and individual health the way that this does.